is the voice of the Cayman Islands.
For the Health of It with Tara Bush.
Brought to you by the Health Services Authority. Caring people, quality service. Visit hsa.ky.
For the Health of It with Tara Bush.
Brought to you by Healthcare Pharmacy, where they care about your health. 2 locations, Governor Square and Grand Harbor. Refill and transfer prescriptions online. Call 947-8900 or visit healthcarepharmacy.ky. Also brought to you by Cayman Medical Center, Cayman's most awarded private medical clinic.
And UHealth, International University of Miami.
World-class healthcare in the heart of Miami.
The Light Room, your holistic sanctuary for physical and mental restoration, repair, and rejuvenation. The power that made the body heals the body. 38 Pasadora Place, Georgetown. Find us online at www.thelightroom.ky or call 938-HEAL.
For the Health of It with Tara Bush.
There's nothing more important than your health, and seeking expert healthcare with physicians you can trust is what you deserve. UHealth, the University of Miami Health System, offers peace of mind to you and your family with a first-class experience. Our patient coordinators assist with everything you need before, during, and after your stay with us. As South Florida's only academic-based health system, UHealth offers cutting-edge treatment, compassionate care, and life-changing results just a flight away. Learn more at umiamihealth.org/international.
Hi, Corinne. How are you doing, dear?
Hello, Gina. I am not too good. I can't seem to get on top of my health issues.
I'm so sorry to hear this. Have you been to the Light Room? I understand they're getting remarkable results with all sorts of physical and mental issues.
What is the Light Room?
It is a self-healing sanctuary that uses clinically proven multi-bio-energy fields and frequencies, including light and sound, to bring the body, mind, and spirit into balance. You simply go in, lie down, and relax, and your body synchronizes with the frequencies. It charges up the cellular voltage, brings left and right brain into balance. Simply put, it provides the body with the right environment to heal itself. No side effects or contraindication.
It sounds exactly like what I need. Where is it located?
They're located at 38 Pasadora Place. You can book online at www.thelightroom.ky or call 938-HEAL, 938-4325.
For the Health of It is brought to you by the Cayman Medical Center, Cayman's most awarded private medical clinic located in the heart of Georgetown. Our spa-like setting offers unprecedented privacy and comfort, as well as highly skilled practitioners in pain management, chiropractic, physiotherapy, orthopedics, and radiology, with our state-of-the-art open and dynamic in-motion MRI. Our new family medicine and urgent care clinic brings further expertise to our group of specialists who offer a holistic and multidisciplinary teamwork approach to our patients' overall health and well-being. Visit our website at medical.ky or call us at 623-1000 for further information. Cayman Medical wishes you good health.
Hello, good people. This is Uncle Selvin. Long time you not hear from me. When I was growing up around here, if you was not feeling too good, there's nothing in a dip in the sea couldn't clear up. Or better yet, your mama would fix you some good bush tea. Mind you, they still works. But the truth be told, those were simpler times when advice about your health and wellness was pretty straightforward. And you trusted it. Today, around here for trusted advice, the folks at Healthcare Pharmacy is the ones I trust. Their team of healthcare professionals and pharmacists have been serving this community now for over 30 years. Healthcare Pharmacy with 2 locations, Grand Harbor and Governor Square. You can reach them wherever you is.
Hello and welcome to today. I'll be interviewing Rachel Farrington. She's a therapist, counselor at Infinite Mind Care. Hello and welcome to For the Health of It, Rachel.
Hi, Tara. Thank you so much for having me today.
It's a pleasure. Could you introduce and tell the audience what you do at Infinite Mind Care?
Of course. So at Infinite Mind Care, I am a marriage and family therapist and associate neurofeedback provider. So I work with individuals, couples, families, as well as doing neurofeedback. Sometimes that's on its own, and sometimes that is with my individual clients as well. ADHD, depression, anxiety, a range of things, which I'm sure we will get into soon.
Okay. In fact, our show today is an emphasis on neurofeedback. So, what is neurofeedback? How does it help with mental health?
So, in simple terms, neurofeedback is like a workout for your brain. We are exercising specific functions to create healthier patterns of electrical activity. Neurofeedback is non-invasive, and it's a way that we can strengthen neural pathways that are related to focus, relaxation, and emotional regulation. And when you consistently train, you're enhancing your mental fitness, and you're able to achieve better cognitive and emotional performance, which in turn helps to reduce our mental health symptoms.
Okay, so it's not like you're not hooked up to microbes and it's zapping you. Like you're going to make a bad choice, It's not electric shock.
No, not at all. But that is what a lot of people think. And I get it. I understand that. So there's a big misconception that there are electrical currents passing through the brain or you're being shocked, but that's not the case at all. Neurofeedback has minimal side effects and it's safe for most people, including pregnant mothers.
Is it good like for addiction problems, or is it you stay away from that? Is it one thing it's better on than others, or is it just a whole host?
No, it's really a whole host of things because we are looking at training the entire brain. For the most part, we're training the organ, your actual brain. So we're touching on, it could be anxiety, depression, PTSD, sleep issues, ADHD, concussions, memory, pain, learning disabilities, addiction, autism. There is a range of things that neurofeedback can help with.
How can neurofeedback help break down unhealthy patterns of thinking or behaviors?
Neurofeedback does this by training the brain to be in an optimal, relaxed state. And this allows the brain to be in the best state to learn and build new patterns of thinking and implementing new habits. So, for example, the most feedback I get from clients is that I feel more relaxed, I have less anxiety and less irritable, and in the moment, I'm better able to make changes. So let's say somebody is doing neurofeedback and they're also in therapy and they have, everybody gets homework from therapy. You're better able to practice those new coping skills, your homework that you're getting from your therapist. That helps you to regulate your anger, better decision making. So we're basically putting your brain into that relaxed state so you have more access to your prefrontals, which is where our decision making comes from.
Okay. Can the neurofeedback actually rewire the brain to form healthier patterns? And how long does that take?
So yes, it absolutely can do this. And this can be more accurately measured with brain maps. So we can do brain maps which take images of the brain and it compares it to a database with other brain maps, and it gives you a comparison of a healthy brain with your age and gender. And then it gives you a whole range of what could be going on with your prefrontals, your parietal lobe, your temporal lobes. And after completing your training sessions, you do another brain map and you can see the changes that were made. As for how long it takes, it can vary. It's pretty standard to go 2 to 3 times a week for about 4 months. And some people may come for top-up sessions maybe once a year. But if somebody has more severe mental health or other health issues, they might need longer-term care. So every brain is different, but combining neurofeedback with psychotherapy, it can help strengthen the results and provide more lasting change.
You said brain mapping before. Is this something that you typically do? Do you do it in-house or do you go out to another medical facility? How does it work?
So we can do brain maps at Infinite Mind Care. You have the option of doing the brain map and getting all of that information. Sometimes it's very helpful and needed to do the brain map, and in some cases it's not totally necessary. It really depends on the individual and their needs.
Are there any specific patterns that neurofeedback targets to help people make lasting changes, or is every brain, again, different?
So, yes. More so, every brain is different, but each person has a specific protocol that we work with. So if somebody's impacted by developmental trauma, we might target the parietal area of the brain. Or if somebody is struggling with instabilities like migraines or vertigo, we might switch to interhemispheric training. Or if there's ADHD, we might focus on the left prefrontal. So we do a comprehensive evaluation, and we're able to clinically decide what regions of the brain that we want to target, since we know what patterns of dysregulation in the brain waves create the conditions that people may be coming to us for. So we have a pretty good idea of, depending on what's going on, where we're going to train.
So is this done, neurofeedback works better with cognitive behavior therapy, or is it done on its own?
They can definitely be used together, or they can be used separately. Really, the biggest difference is that CBT is psychotherapy and neurofeedback doesn't have a talk therapy component to it. So neurofeedback is training the brain, which means we're rewiring the brain, and then talk therapy is related to the mind, whereas neurofeedback is more related to the organ, the brain.
Okay, this might be a good time to kind of explain, like when you come into a session, explain to the audience how it kind of works. Because I know when we go and do CBT, we just sit down and unload to our therapist, right? But with neurofeedback, what do you do and how does it, we kind of explain how it works, but what do they do to, make it work, so to speak?
Yeah, of course. So, a typical session, you come in, you do the assessment process, which is where we're gathering all the information, creating the treatment plan. But when it comes to actually doing the neurofeedback, we have an EEG, and we are strategically placing electrodes on different areas of the brain and allowing us to monitor the brain's activity in real time. Through this monitoring, your brain is being nudged to self-regulate and relax, which is an important part for optimal brain function. And this process helps your brain identify areas of deficiency and then trains the brain to become more adaptable and efficient. I can go into, we place the electrodes on your scalp. You're looking at a screen. We're getting you into a state of relaxation. And this is where the quote unquote exercise is happening. But there's also a lot of changes being made outside of session. So the neurofeedback doesn't just stop as everything is shut down. When you walk out of the room, you're still feeling some effects and your brain is still making changes.
Are there any specific types of people or cases where neurofeedback is more suitable than, say, CBT?
I would say that neurofeedback can work really well for people who don't want to sit down and talk about their problems. Neurofeedback can alter the brain chemistry in a non-medication way, and it helps without the person having to dive deep into past traumas that may be really painful, things that they're not ready or don't want to talk about yet. So in a case like that, it could be beneficial to maybe start off with the neurofeedback and then, see where that takes you. But it's good for people who struggle with verbalizing their thoughts and feelings because it doesn't require extensive talking.
Rachel, is neurofeedback safe for everyone?
Neurofeedback is pretty much safe for everyone with minimal side effects. So neurofeedback is safe for children, teens, adults, pregnant women. There are even neurofeedback providers that work on infants as young as 6 months old. So it is a very, very safe tool for mental health. And I can talk a little bit about side effects.
Yes, please. And what are the risks?
Yeah. So the risk is typically pretty minimal. The side effects could be something like a headache or maybe a disruption in sleep in the first few sessions of training. And typically what's happening during that time is your brain and body are giving us feedback on what kind of adjustments that we might want to make in your next session. So we really take our time to gather what's happened and what's going on for you between each session. And then we make those adjustments. And usually within the first few sessions, those side effects typically go away. If somebody is coming in with a migraine disorder, there's something along those lines going on. Neurofeedback can certainly help to work to bring that down. And there's been times where the migraines do go away completely, or they're just minimized and they might come and go, but it's better than it was before. It depends on the severity of the case and what people are doing outside of session as well. One thing I didn't touch on too was using substances while you're doing neurofeedback. So over drinking or smoking certain substances, all of that may interfere with your progress and how much you're seeing from your neurofeedback.
Are there any side effects?
Yeah, so the side effects might be like maybe getting a headache in session or having difficulty falling asleep that night of training, and that gives us information, okay, next time we need to adjust our settings to look like this or to look like that. But other than that, there's not really too much going on in terms of side effects.
Going back to the brain waves again, there's some research where when you're trying to create abundance and you have to get your brain to this, is it gamma or beta or whatever, the theta kind of state. Is there such a thing with neurofeedback, or that's all a myth?
So I think what you're getting at a little bit more is what we would consider traditional neurofeedback. So neurofeedback has been around for about 60 years, and the traditional neurofeedback looks more at training the different brain waves to be at certain thresholds. And that might be a little bit more about what you're getting at. But with what we're doing, specifically with the ILF, infralow frequencies Othmer method, that is more so looking at it at the neuronal level. And we're getting the brain to be in a state of relaxation, so neurons are firing as they should. We're kind of giving it that right environment for it to do what it needs to do.
Can you give a, for instance, like an example where you've had great success without sharing your client's name, of course?
We had a few cases with some really good success. Trying to think if there's something in the last year that really sticks out. I've had recently some success with a teen who was really struggling in school, had to drop out, go into homeschool, a lot of depression, a lot of anxiety. And after about 6 months of doing neurofeedback, and they also did some talk therapy on the side as well, but they were able to get back in school and start socializing again, leaving their house, which was a massive, massive win for them. I've also had people with PTSD. We've been able to really reduce a lot of those symptoms. Nightmares have been a really big one, and just less triggers throughout the day. Anxiety is also something that I always see a really, really big change in. So if anxiety is a big symptom for something, usually we can see that start to go down within the first few weeks of training or the first few sessions that they've had.
Do you see like a rise in wearable tech for at-home neurofeedback devices? And how do you see the future of self-guided neurofeedback evolving and challenges that might arise from that space?
Okay, I'll talk about this as much as I know about it.
Okay.
But I'm not too familiar with the at-home tech. My thoughts are that in theory, it would be amazing for this to be easily accessible for everyone. I would want to make sure that people are training with the right protocols and that they do have some assistance and guidance as they're doing this. I don't know too much about it, but that would just be my only concern, and I think it would be great for everyone to have access to this.
Okay. Because it's kind of pricey, right?
Yes. Neurofeedback is about the same price as psychotherapy right now. And some insurance companies do cover.
Okay.
So I think to find out, it would be important to contact your mental health company, the billing or admin, and having them check into your insurance coverage and seeing whether or not if it's covered.
Do you think it can contribute to the emotional intelligence or resilience for people like first responders who are in a high-stressed environment?
Yes, absolutely. And I have worked with some first responders doing the neurofeedback, and there was notable differences before and after neurofeedback on their ability to bounce back after going through a traumatic experience or, saving somebody and having to be witness to a lot of awful things. There is something to say about the resilience that it can bring the brain.
Do you have a theory about how that works?
Truly believe it just all ties back to having optimal brain health, which is kind of at the core of neurofeedback.
So this falls onto age-relating brain. Do you think it's going to be used for people who might be facing dementia, or is it being used for that? And does it help the brain's plasticity? Excuse my...
I always mess up that word too.
Hi, Corinne. How are you doing, dear?
Hello, Gina. I am not too.
When I first started going to Healthcare Pharmacy, it was because it was convenient. But over the years, I continued to shop there because I trusted them. One day I was picking up my prescription, and the pharmacist noticed an over-the-counter medication in my basket. She said, "I hope that's not yours. It will interact with your prescription." And I thought, wow, thank you. Trust is so important when it comes to your health. Healthcare Pharmacy, with 2 locations, Grand Harbor and Governor Square, where they care about my health.
For the Health of It with Tara Bush.
Brought to you by the Health Services Authority, caring people, quality service. Visit hsa.ky.
For the Health of It with Tara Bush.
Brought to you by Healthcare Pharmacy, where they care about your health. 2 locations, Governor Square and Grand Harbor. Refill and transfer prescriptions online. Call 947-8900 or visit healthcarepharmacy.ky.
Also brought to you by Cayman Medical Center, Cayman's most awarded private medical clinic.
And UHealth, International University of Miami.
World-class healthcare in the heart of Miami.
The Light Room, your holistic sanctuary for physical and mental restoration, repair, and rejuvenation. The power that made the body heals the body. 38 Pasadora Place, Georgetown. Find us online at www.thelightroom.ky or call 938-HEAL.
For the Health of It with Tara Bush.
Covering Little Cayman, Cayman Bride.
Cover me. Radio